Hi, everyone. My name is Lauren Tremblay. I'm a medical education fellow in emergency medicine at the University of Pittsburgh. Today, I'm presenting on behalf of my colleagues our work entitled Gender Bias in Faculty Evaluations of Emergency Medicine Residents in Task-Based Simulation Videos. None of the authors have any financial or other disclosures to report. Previous research has identified certain traits associated with the male gender, referred to as agentic traits, and certain traits associated with the female gender, or communal traits. Within emergency medicine, not only have male residents been found to attain milestones at a faster rate than their female colleagues, they also receive much more praise for certain agentic traits, such as critical decision-making. While simulation has shown promise in mitigating these gender-based disparities, none of the previous research has truly isolated gender as the variable of interest, as they were either conducted in a clinical setting or failed to adequately control for resident performance level. The objective of my study was to assess for gender bias in faculty evaluations of EM residents in task-based simulation videos. We take the literature one step further by using entirely scripted scenarios, resulting in identical male and female videos, with the only difference being resident gender. We chose to study a cardiac arrest simulation, which is thought to comprise more of agentic type skills, and a death notification or bad news simulation, which is thought to comprise more of communal type skills. The cases were written to be as close to a meets expectations or average performance level as possible. In the cardiac arrest, the resident runs the code according to ACLS guidelines and eventually recognizes the indication for termination of resuscitative efforts and calls time of death. In the bad news case, the resident then informs the wife of the patient of his death, generally following the Spikes method of delivering bad news. We created identical male and female versions of each case at our institution simulation center, featuring one male and one female EM intern, as you can see here in the screenshots of the videos in figure 1. The same 2 residents performed each case, yielding a total of 2 cardiac arrest videos and 2 bad news videos for faculty review. Unique assessments were created for each scenario. Each one consisted of 8 items scored on a 1 to 5 Likert type scale system. The individual items assessed how well the resident performed critical actions of each task. Faculty demographics were also obtained, including age, faculty gender, race, and academic rank. Faculty were blinded to the true purpose of the study and were told that the video review was to evaluate the reliability of formal assessments for simulation cases. Eligible faculty included those that taught at least one primary teaching site for the EM residency. All eligible faculty underwent simple randomization into groups stratified by faculty gender and were either assigned to group A, who saw the male in the arrest and the female in the bad news, or vice versa for group B. Faculty were individually emailed the links to the videos and the assessment links. Data was collected over a 2-month period from July to September of 2020. For our statistical analysis, we performed multivariable linear regression on each case, examining if the effect of resident gender was statistically significant on the overall score, while accounting for other faculty demographics such as age, gender, race, and academic rank. The overall completion rate was 78.5%. And from table 1, you can see that the demographic characteristics were generally similar across the 2 groups. From table 2, you can see that in both the cardiac arrest and the bad news cases, there were no significant effect of resident gender on the overall score. Further, none of the faculty demographics reached any statistical significance either. The main limitation of our study is that it was a single site study with a very small sample size of faculty. There is also a risk of bias toward either the single male or female intern featured in the videos, though we use incoming interns in order to counteract for this. Finally, use of a scripted simulation scenario could potentially limit generalizability to a real clinical setting. In conclusion, in our study of faculty evaluations of EM residents, we did not find any statistically significant effect of resident gender on the overall scores in either the cardiac arrest or the death notification simulation video cases. Our findings may lend support to the fact that simulation may be an effective tool to ensure more equal evaluations of EM residents. So that's all I have. Please feel free to email me to discuss further or with any questions.